Welcome to Sex Help for Smart People. I'm your host, Dr. Laura Jurgens, former science professor turned somatic sexologist and intimacy coach. This podcast is all about helping smart women over 40 and their partners of all genders get the evidence-based relationship and intimacy support you need for great sex and connections. I'm glad you're here, so let's get at it. Hey, welcome to episode 47, my friends. We are doing another episode showing you different kinds of help available for sexual challenges. And today we are focusing on physical pain, especially pelvic pain. And I'm sharing an interview with the wonderful Dr. Susie Gronski, an expert pelvic physical therapist. I co-refer back and forth with a lot of pelvic physical therapists because our work is really complementary, especially for people who have pelvic pain or genital pain or sort of genital physical actual dysfunctions that they are working on. So I hope this episode will help you understand when to reach out to a pelvic PT for help. All right. Hey, everyone. I want to offer a big welcome to our guest today. I am so excited to have her here. She has over a decade of experience in pelvic and sexual health. Dr. Susie Gronski. She's a licensed doctor of physical therapy, a pelvic health specialist, an ASEX certified sexuality educator, and the founder of a multidisciplinary pelvic health clinic in Asheville, North Carolina, right in my neck of the woods. You can follow her on YouTube, where she educates and empowers people by addressing taboo pelvic and sexual health topics and works to dispel misinformation. And to learn more about her and her team, you can just visit drsusieg.com, which is going to be in the show notes for you. So welcome, Susie. I'm so glad you are here.
Thank you so much for having me.
Yeah, so we are going to dive in, everybody, to talking about specifically a lot about pelvic and sexual pain today. So, Susie, I'm just going to let you kind of just take the floor and tell us a little bit about the symptoms of sexual pain. What are we talking about here?
So the symptoms of sexual pain are going to vary depending on person and genital orientation, but in general, any uncomfortable, unpleasant, persistent, unwanted, painful experience related to sexual function or any sexual activity in the genitals. So that could be the penis, the clitoris, that could be the scrotum or testes, that could be any place in between the area located between your butt bones. It can also include the anus, the tailbone, the groin, the lower abdomen, and even just internally for some folks as well. Some of the characteristics or the qualities of sexual pain can range from feeling sore to sharp, burning, itching, zinging, zapping, or just, again, just uncomfortable and not feeling normal or pleasurable.
Great. Thank you so much. And so when you're seeing those kind of symptoms, what are some of the causes for them? I mean, I know they might be similar or different depending on what kind of genital configuration you have, but are there, and maybe you can talk a little bit to the similarities and the differences that you see.
Right. Yeah. So the causes are often multifactorial, really. So my perspective of looking at sexual pain includes the biological aspects that might be contributing, the psychological, and then the social, cultural, relational aspects, because we do know that our psychology is part of our physiology. They're not separate from. And so when we're looking at, in particular, and I'm speaking to persistent pain or chronic pain that lasts, which is defined as pain lasting greater than 3 to 6 months, and does not have a condition or a known pathology associated to the cause of pain. So this is aside from, an infection or any other condition that might allude to or be part of the contributing cause to pain. So for persistent pain, it's a whole person approach to deciding what are the factors that are contributing to a bodily protective response. And we're talking about a systems approach. So pain system hypersensitivity that does include many different factors that could amplify the protective response or inhibit or dampen the protective response. And when it comes to sexual pain, it's an experience in our body that is often frightening, it is a taboo subject, sex and our genitals in general to begin with. And frankly, all people, it's just difficult to talk about such an intimate part of the body, let alone when something is really just not feeling good down there. And so now you have that burden of what's going on with me, something's hurting, who do I talk to? How do I bring it up? And can people help me for this? And so often it does take people a while to even ask for help and also to get the right help. So when something is going wrong, for female identified people or the folks for the vulva, vagina, they'll often go to maybe their primary care physician, but there's a gynecologist that they might go to if they're having pain in the genitals or elsewhere related to sexual function or bladder function or bowel function. But for penis owners, they are often really lost. They have no idea who to go to, when to bring this up, who to bring this up to, and they're not. There's a really huge reluctance and resistance to even ask friends about what's going on because of such a stigma around what it means to have genitals and when something is going wrong with our genitals. So that's a long roundabout answer to when we're talking about pain or persisting pain. We really have to look at the whole person approach. So let's say they have all of the red flags ruled out. There's no infection. Like, for example, that could be for people who have a prostatitis, which is inflammation or infection of the prostate, or maybe a sexually transmitted infection or disease that is the underlying issue. And often, really, in terms of STIs, they're asymptomatic oftentimes. So it's, it's not really like the cause that I would see in the clinic, but it could be something where there was an infection, right? Like a bladder infection, an STI, a prostatitis that then kicked off the cascade of a hyperimmune response. So the infection's gone and that's been cleared and taken care of with antibiotics and formal medical treatment, but the pain persists. And so we see that often in the clinic as well for both, vulvas and penises, where it was triggered by some sort of event, whether biological, meaning an immunological event like an infection, but then the symptoms just persist. And that we can really kind of talk about this systems body approach that just went into a level of protection and did not come back down. And so you have this hyperimmune, hypernervous system protective response that can be elevated or dampened depending on what's going on for that person in their environment, in their general health, in their relationships, everything that just keeps that threat response going.
Yeah. So, and I can imagine there's a lot of doctors that, like, if they do go to their primary care doctor for that, the doctor is looking at the initial instigating infection or injury and is like, well, that's gone. So it's all in your head.
Right.
And so we get a lot of dismissiveness, unfortunately, from the medical establishment because people don't realize how little sexuality training and how little genital training that most doctors get. And even gynecologists, a lot of them get a lot of training around female reproduction, but not around female sexual function. So I love that I just am so glad that there's specialists like you who actually understand that this is not just a sort of like an acute response isn't the end of the story. That's really important.
Right. And to your point of medical providers who really have a narrow or myopic framework as far as being able to support people, and it's not their fault, but it's just the institution and the training and the lack thereof of fully being able to support people with their sexual health needs. And so that's not making an excuse, of course. We need to do better. I think, when I say we, it's the collective we need to do better in supporting folks with their sexuality and sexual health concerns because it is part of their health. And yes, they don't have the training. And often people are misinformed thinking that they do have the training and only to then be told, well, there's nothing that we can find on a scan. There's no test that's we can point to that is the cause of your pain. Ergo, as you're saying, well, it must be all in your head. And that is often what people, once they find a provider like myself, which is sadly, the statistics around that are really, really startling because it is several years of dealing with a pain problem, a pelvic pain problem, a sexual pain problem, that they start to find people who can actually support them with a level of care that they deserve. And that's healthcare justice. And that is unfortunate because that's not what's happening right off the bat, where we're not getting referrals to a rehabilitation specialist or musculoskeletal specialist who can really support someone in need with pain. Because let's be honest, like, again, most people are going to their provider because something is bothering them or they're most likely in pain. And these medical providers, not only are they not trained in sexual health and wellness as sexual medicine, but they're also lacking sorely pain neuroscience education and contemporary modern pain science and care and the ability to deliver quality care related to
It
their
happens
pain.
with all kinds of pain, right? Not just sexual pain,
Right.
but when we're talking about
Exactly.
sexual pain, it's even worse because what you were saying is so important. It's so hard for people to talk about in the first place. And a lot of people have a hard time even bringing it up to their doctor. So if there's any flavor, any like hint of dismissiveness, it's just going to shut them down. And then they could spend even more time feeling like there's no
Right.
help out there and there's nothing, and they shouldn't
Exactly.
even bring it up. So
Exactly.
this is one of the reasons why I wanted you here. And I'm so glad you're talking about this today, because
And it
people
makes the
really,
pain problem worse.
it makes it
Yeah.
so much worse when you have all this,
Right.
like now you're trying to suppress and you're trying to deny what you're
Right.
feeling and you're saying, oh, like this is in my head, or like you're just trying to take,
Right.
NSAIDs or something, and then you wind up with
Right.
whatever, kidney failure because you've taken so much Tylenol for years. So when you are treating this sexual pain, when someone
Mhm.
is fortunate enough to get a referral or just discover you or, hear you on a
Mhm.
podcast and decide, oh, I need that help, and they come in, what what do you do as a pelvic floor therapist with them
Yeah.
for treating
Yeah.
sexual pain? And I'm sure it really runs a gamut, but could you just give us a couple examples of sort of maybe, an exam and then some treatment
Mhm.
examples for different common types of pelvic pain?
Absolutely. So what it looks like in the beginning is the person will come in, will have an intake, getting the full perspective of like, when did this problem start? How is it impacting your life? And how do you want things to change? What does better look like for you? And that does include a sexual health intake because we're dealing with our genitals and genitals have a function. And so, it is kind of opening up the permission to talk about these concerns, which probably in most cases, this is the first time that anyone has had the permission to actually lean into this space to talk about all the questions and all the worries that they might have related to their sexual health and function, which then ties into what's happening with their bladder and what's happening with their bowel, because these, the genitals, the bladder, bowel, and the reproductive organs all share and occupy the same spaces, which means that they're all communicating with each other. So from pelvic floor therapy. So, what is the pelvic floor? We should probably start there because some of the listeners might not even know what that is, and that's okay.
Yeah, and oh my
And
gosh, so much musculature and all kinds of stuff going on in there.
yeah, yeah. So the pelvic
Upright
floor,
upright mammals, we're weirdos.
right? Exactly. Just different. Weird. It doesn't have to be bad. It's
No,
just
weird
it's
doesn't,
weird
I
can be
embrace weird, but like upright mammals, we're very
good.
specific in like how our pelvis is oriented and what's going
Oh,
on there. So
totally.
yeah, maybe you
Yeah,
can tell us a little
totally.
bit more about that.
Totally. So everything in between your butt bones. So right now, if you're sitting or whatever position you're in, if you were to just take your hands and feel around the bony parts of your butt that you usually sit on, everything in the middle is basically the perineum or the pelvic floor. And so you have external muscles and nerves. That also includes the genitals. So whether it's the penis or clitoris, you may have a few openings. So in someone who has a penis, there's only two, which is the urethra, which is the opening that you pee out of. In females, or if you have vulva or vagina, you also have a urethra that empties your bladder. You use to pee out of. And then for those who have a vagina, there's a vaginal opening, and then there's the anus that connects to the rectum. But all of these openings are supported by musculature, and there are three unique layers to the pelvic floor. Again, you could think about it as a bowl, which is like to put it simply, it's like a hammock-like muscle orientation that extends from the inside of the pubic bone, which is the bony part in the front of your body. So if you were to feel around your bladder, like in the lower belly area, and you were to feel like that bony part in like the groin area, then that's the pubic bone itself, just above the genital area. And so there's muscles on the inside of the pelvis that go from that pubic bone and then connect to the tailbone and other parts of the pelvis on the inside. And so those are the deep, we would call the levator ani muscles. And again, they're there to support bladder, rectum, prostate if you have one, uterus and ovaries if you have those. And they're there to help support and stabilize those organs, but also help for postural force production, adapted to different loads, and most importantly, keeping you from pooping and peeing on yourself. So that is a huge function for these tiny muscles that live in small space, but they aid in supporting that continence control and those mechanisms to be able to, hey, if I need to go pee, they need to relax so I can pee or poop. And they also need to keep things in when I want to. And if that's not happening, or if any of those functions are painful or impeded in some way, that's where pelvic floor therapy comes in. Now, those are the inside muscles, but you also have muscles that wrap around or intimately connect with the genitals. And again, the muscles are going to be the same. The orientation might be a little bit different because for penises, those organs are more on the outside and more visible than for those that have a clitoris or a vulva. Or vulva with a clitoris. So it's just orientation is a little different, but function and muscles are really the same, and the nerves are the same, and the vasculature is the same. So you have muscles that support sexual function as well. And these muscles aid in being able to experience an orgasm or pleasure sensation in the genitals. They also aid in ejaculation for both penises and clitorises. And so these muscles are really important in our experience of sexual health and function. And what else can I say about these muscles that are really important? Pelvic floor. Yeah, I think
I wonder, there's also kind of the role of like, not just like the tone of the muscle and being able to have that like holding, but also being able to relax them. Right? Like
yes,
a lot of the dysfunction that we see, or the functions that we would like to enhance, are due to like a challenge in actually relaxing some of those muscles. We can hold a lot of emotional tension, a lot of like trauma tension. And also just like if you happen to be a person who like holds a little anxiety in your pelvis, it can kind of play out in all kinds of ways in your sexual
I'm glad you brought that up.
Yeah,
because for those that have vulvas and vaginas, there are conditions like vaginismus, which is the involuntary spasm of the pelvic floor muscles that are essentially the gatekeepers around the vagina. You have a group of muscles that close down. And some people might feel like, hey, I'm trying to insert something, a tampon, a toy, a penis, a dildo, whatever. And it feels like there's a wall. There's a wall. I can't go in. And then it often is distressing and also painful because that adds to friction and that adds to pressure. And then again, the anxiety that just, protect from threat muscles also guard and protect, and it's a vicious cycle. So, that's vaginismus is a unique condition with that. But then also you have dyspareunia, which is pain with intercourse, pain with anal or vaginal intercourse, right? So sex should never be painful unless you want it to be. And that's cool because that's a kink in its own, and that's fine, but that's consensual and it's wanted. But the work that we do here in my office is working with folks that do not want to experience pain in their sexual experiences. And when they come into the office, that's what we're assessing. So to go back to your question of like, what should people expect during a pelvic floor exam, is really an expert to look at the genitals and everything in between the genitals to the anus to assess for muscle tone, to assess for muscle function, which includes the ability to contract and relax, and body awareness with that. You'd be surprised how many people are not aware of how to do that or even connect with that part of their body. So we do a lot of like brain body work, essentially, is to help people feel what it's like to feel different here. And our goal is to feel different better, feel less threat. Different, better, like less threat, less guarding, and feel safe in our bodies, because we need safety in order to experience any kind of pleasure, not just sexual pleasure, but pleasure in life. If there's something that's bothering me, that hurts me, that I'm worried about, that's weighing me down, that I have no answers for, I'm not going to really enjoy much in my life. And in fact, people that have sexual pain or genital pain often tend to withdraw and retreat. They avoid sexual activity. They will avoid sexual engagement with themselves or with partners, and that further perpetuates the cycle of this pain problem gets bigger and life gets smaller. And so my role as a therapist is helping their brain and body connect better, helping them to feel safe in their bodies and equipping them with the tools. So that might be manual therapy, again, depending on what we find, what the examination finds. We collaborate together in a partnership to say, hey, how can we help you feel better, and to prove to your body and to your brain that you're safe. And that might mean touch therapies, safe touch therapies. Therapy should never feel painful in order to get better. Like, that is a huge pet peeve of mine that I often hear in my world, of like folks that come in and say, I've had pelvic therapy before and it was super painful and I had to take all this medication or suppositories to like relax my body because it just hurt so bad. And I'm like, wait a second, we're doing that all wrong. Like,
that's not right.
We want to feel good. No, it's not right. Like, no, like you should feel empowered to say, A, that hurts, and stop. And also, we need to do something different. Like, that's just perpetuating the cycle. So I'm here really to, again, help this person feel that their body is robust, their body is strong, and that pain can change, and that they can feel safe in their body. And so the exam is all about mapping what feels good. I take a different approach. I don't go and say, this is what's wrong with you and that's what's wrong with you, because all of that nocibic language, all of that language that's negative or scary tends to also play into the context of pain. So I'll often reframe and say, opportunities for growth, or here's what we can do to help you feel more relaxed in your body and safe. Here's what I'm noticing. Can you see that? Maybe we'll use a mirror, for their genitals, and just to kind of orient people to their genitals, just to bridge in the sex education part. Like, do you know what your genitals look like?
A lot of that stuff, there's so much stigma around it. And I mean, the world I grew up in, right, there was a lot of disgust for female genitals. And I had a lot of internalized hatred and fear of, I just I thought female genitals were gross for the longest time, including my own. And so it was very difficult I had to do a lot of work on myself, re-educating myself about, wow, how did I get this? And maybe I need to give it back because this isn't mine. None of us are born with shame around our genitals. And so I love that you're doing a more positive and sort of strengths-based approach, because that's what I do in my practice on the emotional side too. And on the helping people just connect, we have this idea that personal growth has to be painful and awful. And it's totally wrong. It's actually way better and more fun. It's not painful and awful. And if it's there may be growing edges that are slightly uncomfortable, and that is that, as long as it's sort of on the tolerable, not so bad side, even whether it's emotional or physical, it's okay, here's a growing edge. I might need to work on this or something. It's like building a new muscle, right?
Yeah.
But I find, I get a lot of, I do a lot of support for people around arousal because, and when I work with some pelvic PTs, I notice that they might not address arousal as a really important part, especially for women, of the sort of pain solution. And, they're trying to get people to use dilators, for example, without giving them any support around arousal, and actually having their tissues be ready for and having their body be ready and interested in having. It's sort of more no, we're just going to try to get this thing to go stick inside you no matter what happens, and how impacted your tissues are. And that can be really problematic if you have sexual pain or a sexual trauma history. It's a really horrible thing. It's like re-traumatizing yourself. So I'm wondering if you have any thoughts on sort of, and a lot of women, of course, don't even know what turns them on. And so that's when they come to me, and we figure that out and help them make sure that they're getting enough of it in foreplay and that they know what arousal feels like. And then we can work with the exercises with the pelvic PT is giving them in the context of their own arousal, which generally gives better results. And I'm wondering, what do you think about why are a lot of pelvic PTs not really even talking about arousal when we're trying to think about things like pelvic pain?
That's such a good question. My answer to that is sexual ambiguity. Because physical therapy as a profession in general is very the curriculum is very biomedical. Now, the occupational therapist, on the other hand, the pelvic floor occupational therapist, whose curriculum is rooted in the biopsychosocial approach to begin with, they are very well equipped and also don't shy away from talking about pooping, peeing, and sex right from the get-go, because it's ingrained in their curriculum, and they do speak about arousal and pleasure, etc. So sexuality is like almost the conversation around sexuality and sexual health and adaptation and pleasure and arousal. I mean, sensory integration is part of their curriculum as well. And really, we do sensory integration as pelvic therapists or pelvic floor physical therapists, but that really comes from the wonderful aspects of occupation, our colleagues in the occupational therapy profession. So we are a little, like, again, the original training for physical therapists is very biomedical, muscles and bones. And what we're forgetting is that the muscles and bones are part of a human being.
A person. They're attached to a person.
Right. It's
with a whole bunch of experiences. Yeah.
You can't just like yank on a muscle and because it's very reductionistic way of thinking. It's a very reductionistic way of thinking to think, if I just stretch this or poke at this or massage that, then it should be all better. I'm like, well, no, because muscles don't just do things to do them. They get signals that are from the brain, from the spinal cord, from the environment. All these factors influence the connection between the brain and the body. And if there is any form of threat, and we're not addressing that, we're not addressing experiences of pleasure and safety, there's no amount of stretching that you would do here with a dilator or a massage gun or whatever it is that whatever doohickey you choose to use, it will not work. Why? Because you have innate systems that are more powerful than just, well, let me stretch this muscle.
The body's trying to keep this person safe for a reason, and they've got this coping mechanism for a reason.
You have to address that.
Internalized there, yeah.
You have to address that.
If you're a person who's, say, not in the Asheville area and can't come to you, but they're looking for a pelvic floor PT, are there any particular questions you would suggest that they ask somebody to determine whether they're going to be a person who's going to come with that type of perspective, or they might have, or they might want to be careful? Because, in any profession, I mean, whether you're a brain surgeon, whether you're a lawyer, whether you're, professor, whatever you are, auto mechanic, a coach, a pelvic floor PT, there's variation in how people are trained and whether they're a good fit for you. And I wonder, for you, do you have any suggestions about what kind of questions people would ask in order to be discerning about who they're choosing to work with?
That's a really great question. And I'm gonna share my answer from the perspective of those who have penises and those who have vulvas, because the answer may be very different. In a profession, the pelvic therapy profession in general, it is female identified and very gynocentric. So what that means is that you have a lot more practitioners who offer pelvic therapy for those who look like them. Okay. And they feel more comfortable working in those spaces, and that's completely fine. There is a huge gap in care offered to those with penises because of the fact that there's a sexual ambiguity within that space, and there's a lack of training in being able to confidently, with healthy boundaries, without sexualizing an experience, to support someone that has genitals different from your own. Because there's so much, and I won't go into it, but you know this, Laura. I mean, there's
like
so much.
A heteronormative sexual and fear, and also legitimately a lot of women have been harassed, and it is hard and women are not trained to hold boundaries, and there's a lot of men who are boundary pushers, and so but there's a lot of men who aren't, who are just looking for help.
Right, exactly 100%. So there's the sexual ambiguity piece that exists more so for those who have penises, who are looking for help, genuinely looking for help because they are in pain and just desperate and hopeless and really need providers like ourselves to work with them. And for those who have vulvas, it is a lot easier to access pelvic therapy care. Now, to your question of the sexual piece, I would say if the individual you're speaking to has sexual medicine training or some sort of sexuality training, ask about that. Ask what is your approach around sexuality and sexual health concerns? What training do you have around sexual health or sexuality concerns like myself, what would be your approach to this issue? And really what you're looking for is someone that's going to not just say, oh, do this exercise or take this dilator and use it this way, but someone who's going to say, you know what, we're going to work together to help you feel safe and pleasurable in your body. And that might mean working with ways of how to touch your own self that feel safe, working with your partner and bringing your partner into sessions because it's often, or partners into sessions because it's bridging that gap of like, hey, this is scary and I don't know what to do, to, hey, I want to feel good in my body again. And these are my support systems. And you welcome all of those systems. So if the person's having a very open, candid conversation and is not afraid to ask questions around or hear questions related to sexual health, then I would say you're probably in a good space. Mm-hmm. That being said, for both, I would say penises and vulvas, although it's more common for female providers, practitioners who work with people who look like themselves, they're not afraid to assess the clitoris. They're not afraid to touch genital organs or genital structures. Mm-hmm. Now, that's not the same for penises. And so if you're working with a provider and you have penis pain, for example, you have your pain is at the tip or the head of the penis or the shaft in that area, let's say with ejaculation or an erection, and your provider does not even look at your genitals or ask you to show you where they hurt or assess that part of your body, but instead tell you to move your genitals out of the way so that they could just do internal work, probably not the right fit for you. Again, this is not me trying to minimize or critique negatively someone's.
Yeah, it's just not the right fit for your issue.
It's just not the right fit. It's not a right fit. And we don't need to go into the specifics about, but it's just not the right fit because you really don't want someone to feel misconstrued. And this is where people who have penises feel very stuck because they're like, I hurt here. And none of my providers are looking there. And to be frank, it's not just pelvic therapists, but it's also like urologists, primary care physicians, dermatologists that just completely overlook the genitals.
Yeah.
It just blows my mind.
Yeah. This is and this is just one of those examples where men are on as so much of the receiving end of the negatives of sexism in our society and not realizing it. But because of sexism and because of some bad behavior by other people have gotten hyper protective and don't discern between somebody with a legitimate issue who's really concerned and is coming from a good place and somebody who might be kind of like creepy, right? Those are very different things. And the vast majority of men who have pain, penis pain or sexual pain are not trying to, go to the doctor in order to like creep on them. They're actually going to the doctor to get help. So right. Shocking as that is, they actually want help for their pain. So I just want to if somebody is in that position, do you do any online work with people or do you any, do you like refer people to providers that can work with people with penis pain and who
both and both and so we do work with people globally, remotely, in different capacities and different forms. I've work with people who are in different states and have a local therapist, and then I act as a case manager or a mentor for essentially connecting that person with, a network or web of support to support them in what they're going on and having a space so that they can actually lean into, and then I can help advocate for them as well and elevate their voice in different spaces. So we work in different capacities with folks, but we do work with people everywhere. So no matter where you're at in the world, just let us know, reach out. We offer, 30-minute consultations just to see kind of what would be the next steps. Is pelvic therapy for you, depending on what's going on? Because it may not be, pelvic therapy related, but maybe sex coaching or maybe surrogate therapy, partner therapy, or maybe sex counseling or sex therapy. Or, sexological model, whatever it is, pelvic therapy might not be the right fit for you based on what your needs and what you're looking for. And that's really what those consultations are about. It's like, what's right for you?
The other question I had for you too was, do you have any recommendations for trans folks who are running up against even more stigma and even more problems with a lot of trans people obviously have pelvic floor issues
Right.
because they've even either gone through surgery or they have a change in their hormones and they have a different relationship with their bodies. They have dysphoria. They don't really know how to how to relate. And
Right.
that can cause a lot of tension and all kinds of things, I'm sure. So I wonder, do you have any suggestions for trans folks, whether trans male, trans female, whatever, trans non-binary, who are looking for pelvic floor physical therapy support?
Again, I would say the same conversation is, can you trust this person if you have an initial meet with them? Are they sensitive to asking all the right questions? Like their intake, for the example, our intake form, it could be very simple as asking, what are your preferred or affirming pronouns? Does this person use or designate their own pronouns when communicating with people in their practice? What is the language on the website?
Yeah. How do you want your genitals to be referred to is a
Right.
common issue that, a lot of people can't even talk to their doctors because they're just going to take, like, the doctor's going to say whatever they're going to say. Right. And we
Exactly
don't
right.
want, and then people are so worried about having that non-affirming experience that they'll often avoid going to see a medical professional. And
Exactly.
that is just a really horrible place to be when you need help and you're so scared that it's going to be so undermining of your sense of self that you won't even go. So,
Right. And safety is an issue,
yeah,
like people
safety
need to
issues.
feel that they're safe and that their concerns are going to be validated and affirmed and taken seriously. And microaggressions, macroaggressions, insensitivities and things like that, like they occur all the time. And I feel like that in itself is perpetuating a trauma and also threatening to individuals. So of course, I think, finding a practitioner that again is open, is not making assumptions that you don't feel judged by, that has maybe more of a gender neutral framework on their website, the language that they use, maybe they designate on their Google page that they're an ally or LGBTQ friendly. Some pelvic therapists, there are a handful of pelvic therapists that are also part of that, identify as part of with the LGBTQ community. And so those people might be a really good, or those therapists might be a really good fit for someone. We have male identifying providers in that space. We also have female identified providers in that space. So there are options. And so, it's about finding, who the right fit might be. And
Yeah,
that's what we offer as well. Like, I
it'll
don't
take a
claim to
little
be
bit of
like,
work, but
yeah,
yeah.
it's like, who might help support this person in the best possible way. And that might not be me. That might be actually someone else who's a better fit.
Yeah, absolutely. We want everybody to get the best possible sort of set of helpers that you need. Sometimes it's one person, sometimes it's sort of a team of people to help you with whatever it is, but your sexual health matters, right? And so many people are not even really sure where to start with that. So I'm so glad that we could have you on to talk about this. Is there anything that you feel like we really needed to talk about that we didn't cover today that you want to kind of make sure we get in?
I think we covered a very broad understanding of, hey, sexual pain is
Yeah.
not normal unless it's warranted. And pooping, peeing, and sex should never feel painful again, unless you want it to be in some way.
Yeah.
And that's okay too. And there's help for that. I think the biggest message that I want folks to walk away with is that please reach out, because there are folks who do this work and who are, we are here to collaborate and partner with you to help you get your quality of life back. It really is a quality of life issue, it's a healthcare justice issue, and there is help for that. So whether it's pooping, peeing, or sex, we are here for you, and there is support. So please reach
Yeah,
out.
absolutely. Thank you so much, Dr. Susie Gronski. And you can find her. I'm going to send, I'll put in the show notes the link to her website. And I am so grateful for you being here and for all the work you're doing. Thank you so much. It was fun to talk with you today.
Thank you so much, Laura.
Hey, if you're curious about how you could have better sex and connections, go grab my free guide, Find Your Secret Turn-Ons. It's right on my website, www.laurajurgens.com, and the link is in the show notes. I'll see you here next time.